In a decisive move to curb the spread of tuberculosis, the Lagos State government has designated female legislators, newly elected female local government chairmen, wives of House of Assembly members, and spouses of council chairmen as TB champions and ambassadors, reaffirming the state's commitment to ending the disease by 2030. The investiture ceremony held at Alausa was led by the First Lady of Lagos State and State TB champion Ibijoke Sanwo-Olu, who said the initiative marks a new phase in empowering women to drive aggressive TB awareness, promote early testing, reduce stigma, and ensure treatment compliance across communities. She urged the honorees to use their influence within households and communities to champion TB messages, advocate increased local funding, integrate TB awareness into meetings and outreach programs, and support patients who face stigma, job loss, malnutrition, and discrimination.
A lot has been said about the burden of TB in Lagos. Lagos State has a high TB burden with over 50,000 cases reported annually in 2024. We notified and placed and treatment 19,500 TB patients. Currently, we have notified and placed on treatment 11,725 from January to September 2025. TB is curable, and that's the message we want our children to take home. Tell your friends, tell them in the communities, TB is curable, so that they stop stigmatizing people in the community. TB is a curable disease, yet it remains a remarkable public health challenge. We must work together to address the social determinants of health, reduce stigma, and increase access to quality TB services. The role of the woman in TB control. As women, you are natural caregivers and influencers. So each and every one of us here are influencers on our own rights. We don't need to be looking for influencers anywhere.
In his opening remarks, the Lagos State Commissioner for Health, Professor Akin Abayomi, expressed concern that many patients discontinue their medication prematurely after initial improvement, a trend that fuels drug-resistant TB, whose treatment costs are significantly higher and may last up to 18 months, posing a serious biosecurity threat in a megacity of over 30 million people.
It is highly likely that one person with tuberculosis will infect several people in their home or in their workspace or in their social environment. It takes almost 6 to 9 months of continuous treatment to cure tuberculosis. And anybody who knows anybody who has had tuberculosis, or maybe you've had it yourself, you will realize that tuberculosis is only curable with attention to detail and commitment of the medical professional staff and you as a patient. And that in itself is difficult, which is why we are converting tuberculosis to a community problem. And hence the reason why we have the distinguished female chairmen and wives of chairmen as being given the responsibility that this is not a hospital or Ministry of Health responsibility. This is a community task.
Your leadership and commitment to TB control are crucial to our collective efforts and to end TB in Lagos. As TB champions, you will play a pivotal role in promoting awareness, reducing stigma, and ensuring access to quality TB services. I commend the Lagos State government and partners for this initiative, which underscores the importance of partnerships in achieving health goals. I am confident that your efforts will significantly impact TB control in Lagos. I wish you success in your new role and look forward to our collective efforts in creating a TB-free Lagos.
Health sector stakeholders described the investiture as both strategic and symbolic, noting that the appointed women occupy influential positions capable of shaping community attitudes and improving health-seeking behavior.
Intervene in and take a very great measure to identify those that has TB in Ekpe local government. As you can see, this is Ekpe, and like I said we have riverine and we have upland in our community. Today I stand before you with a message of a commitment, hope, and all. We are not just an ambassador of Renewed Hope Agenda or TB ambassador, but we stood up and we took it as a responsibility saddled on our shoulder to take up this responsibility and take care of our people, and also with a great measure and intervention on TB. And so far so good, ma. In the chart that I sent, you can see that we surpassed the target. The target's supposed to be like 57, and if you look at our monthly target and chart, we at least in a month over 87, 60 something, in Ekpe local government. And from January, we started 2024 until date, which is November 2025, we are able to at least, at our own distance, we are able to stop TB at a minimal, at least if we are talking about TB, Ekpe will not be in the red charts.
To our newly installed TB champions, let me say this: your title today is not symbolic, it is a responsibility. You are the bridge between government programs, health systems, and the everyday lives of our people. The message you carry into your communities will save lives. To Lagos State, I say with confidence, this action you are taking is what the world is asking for. Political will that translates into action at the grassroots. Together we can make TB a disease of the past. Together we can build healthier communities. Together we can give hope to families who deserve live free of TB.
The investiture of female leaders in Lagos State on tuberculosis control is a testament of how powerful women can be in driving public health in the world. They are solution makers, and by empowering female voices, we strengthen community engagement, improve awareness, and advance the fight against TB for a healthier Lagos and Nigeria as a whole. On behalf of National TB Program, we say thank you so much for leading. We love you, and we thank you for making TB a proud TB program, a proud center, and we hope that other first ladies will follow suit.
The WHO remains committed to supporting Lagos in strengthening primary health care and improving health outcomes for all. We congratulate all the honorees and wish you success as you serve with dedication and impact.
As the ceremony drew to a close, community leaders took turns to reaffirm their personal and institutional commitment to the cause. Speakers emphasized their roles as champions of a broader mission, protecting every man, woman, and child from tuberculosis. Joy Uchejim, TV360, Lagos.